Welcome to another CEO Wisdom Pod with Susan Braddock with us today. She is CEO at BridgeSide Telehealth. That is, she is in Fort Worth, Texas, US. And we're going to talk about telehealth today, which is one of my favorite topics. This podcast is brought to you by podfire.com. If you want to start your podcast, scale it, get sponsors, or even be invited on other podcasts, I can help you do that. Podcasts are an amazing growth mechanism, not only to learn from other people, grow your network, but also get clients. So podfire.com if you need help with your podcast. Susan, welcome to the pod. Can you tell us a bit more about your background and about BridgeSide Telehealth?
Sure. I'm a biochemist. I was in the pharmaceutical industry for a long time, and I'm a serial entrepreneur. So it was a bad fit. I just felt confined every single day, and I felt like I had to lie to people every single day. So I just couldn't do it. So I launched a drug by Purdue Pharma, and then realized what a horrible it didn't fit my values. That's the nicest thing I can say. So I quit. And I began, and I've had, I don't know, this 4 or 5 businesses over the years. I even had a private cooking business. So I've done a lot of different things. I dropped out of the corporate world for a little bit to figure out where I was again and to restore my self-confidence and restore in what I was doing. And then I have flown ever since. A few years ago, before telehealth became cool, before anybody knew what it was, I had a dear ex-husband and a dear friend of mine who I sat down and said, I want to create this business. Will you do the coding for me? And he did. And we finished and put our telehealth out in January 2020 with a big, I hope people will understand that this is a great idea. This is cutting edge. And then we all know it happened in March of 2020. So it's took off from there. And we went from a tiny scale to a huge scale in 90 days. So we learned a lot really fast, and we've been successful. We've had our ups and downs. We were just talking about, success is not a straight line up by any means. And success means subjugating your ego, because I have one, and listening to other people and seeing how they did, and not only listen from their mistakes, but listening from their successes and gleaning from that. I learn more from the screw ups we've made than from the successes. And so in our company, we don't do shame anyway, but we just celebrate. Oh, I really made a mistake, and whatever it is. And then we work as a team to correct it. And then we move up farther, and I just want people to know that success isn't a straight line. And it's you can't see me in a podcast, but it's like going straight up, dropping down 10 feet, and then going up 20.
Yeah. It's really not linear, and just everyday life, the laws of physics are not that way. For example, I have 4 dogs. One of them is quite unruly, and yesterday he just didn't had his day. He was making a total mess, and today he's a bit calmer, and he does the pee-pee outside, not inside, and so forth. So there's good days, there's bad days. Yes, you can add them all up, and it might make some kind of line upward, especially if you're on the 1% betterment daily philosophy, just like I'm in, probably you are. Yeah. But tell us about these challenges that you face, because it must have gone up like pretty quick during the COVID. And then what happened, and how did you resolve these challenges of yours?
Well, and I know other entrepreneurs will see this. Why I enjoy making money is I don't really care. I like creating the business and making it get bigger and bigger. So suddenly this thing exploded financially. And suddenly I had to have, attorneys and CPAs and bookkeepers and accountants. And, telehealth was just everybody. The initial rule of telehealth was that in order for telehealth to be legal, you had to go to a doctor's office and call your doctor. You had to literally be at a medical site of origin. So during that time where, all this money is flowing in and all these people are calling us and all these doctors need us, and we're trying to negotiate individual state telehealth laws to make sure we don't do anything wrong. So I have never had to talk to so many attorneys in my life, and I wished and hope to never have to do that again. But that was fun. That was fun time, so it was heady. I wouldn't I I learn now to do what we call it a soft opening. You know, when you create, I've got several new products we're creating. We're going to open them softly and scale them up. We just had no idea. I mean, we woke up one morning with 10 patients, and the next day we had 3,000.
Wow. Yeah.
Yeah.
So how did it grew so fast? Organically, or did you do some Facebook ads instead?
I did Facebook. I initially hired a call center, never do that, didn't work. But I did Facebook ads and Google ads. And here's the weird thing, it was the doctor's word of mouth. So this particular facet of marketing has changed since then. But at the time, the doctors were desperate to see their patients, and we had the means and the vehicle for them to be able to do it. So they were coming to us with their patients. And then eventually now we have doctors on, we hire doctors, and we've got several of them, and the patients come in through Google ads and through Facebook ads. Podcast is a great idea, by the way, Charles, and good for you for doing it. We'll talk later. But that's how we get most of them, and word of mouth.
Right. And okay, so they have a problem to be resolved: weight management, medications, hair loss, and medication delivery.
Or
Yes,
rashes, style,
rashes.
you know.
Yeah, and they during COVID, I believe at one moment they could see a doctor, but like most of them were kind of skeptics of showing up and catching up all the bugs that were reproducing in there. Sort of after, so okay, during the pandemic, it was like COVID consultations. And
Right.
after it moved towards what we just mentioned, weight management and all of that. Okay.
In America, people can't get an appointment. You can't, like, let's say you want to see a doctor. It takes 3 to 4 months to get in to see a doctor.
Right. And with that being said, with your platform, they can get a meeting. They can get an appointment tomorrow.
Or immediately.
Immediately. Okay. So what is the cost of that? Is it like $90 an hour? Like, how does it work?
It's $85 a consult.
Okay.
Period. End of story. We don't take insurance. We will help people file insurance, but it is the simplest business model in the world. It is a set price for the consult, and the doctors and I split that cost. Simple put. And then we'll send the patient, like I said, it's called an FSA or something, so that they can file insurance if they need to.
Okay. So you take the lower end of the cost, let's say 10 to 20% of the total?
I take the upper end.
The upper end. Wow. Okay. But so I guess the consultations can be quite short, most of the time, like 15 minutes.
Yes, exactly.
Okay.
Yeah.
Okay. Now, the doctors, let's say that they have their offices, they take these appointments in between when they don't have any physical clients. Is that correct? Is that how it goes?
There's a lot. Some do a week on and a week off. We have enough physicians to fill our queue, so that the doctors will send in their schedule the week ahead of time, and then we'll match the doctors with the patients. Some patients want to stay with their doctors, but we match it that way. So our app is on phone or on an iPad, so the doctors can sit at a break or whatever and see their patients. We also do what's called a store and forward for a few things. So the doctors don't always have to speak with the patient. If they need a refill, if they need something minor like that can be taken care of by one of our medical admins.
Right. And what's the importance of a doctor of like touching someone physically via just asking question and observing with their eyes?
Well, what's most important are tests, lab tests, x-rays, things like that. And we can order those and look at those. So we can see the inside of the person very easily. And that's part of what telehealth is good, is that you can look at the person and talk to them. There are devices out that we're looking at that you can literally, they're very inexpensive. You can take somebody's temperature. You can do their blood pressure. You can certainly do their weight. So you can do almost everything, so I think if I was a dermatologist, I would be a little worried, because I'd want a really good look at the patient's skin, or certainly for psychiatry, or there are other ways. There's other things that about a patient's persona that a doctor needs to sense in order to treat them well. Telehealth can do that up to a point. So there's a real serious place in the medical industry for both brick and mortar and telehealth physicians. I would love to have a physician come to people's houses. I've seen that business model too, and it hasn't worked yet. But I think that to me is the ideal patient model. I don't think the doctors probably feel that way.
Right. And after surfing that tsunami that was COVID, I mean, you still have some power left of that behind you. Nowadays, it seems that it's more about weight management, medication, hair loss. Why did you decide to choose these categories? And how do you choose these categories? Like, is it A/B testing? Is it ideation? Then you test on Facebook ads, then you check the profitability. How do you choose like these micro niches?
You're going to love this answer. Well, first of all, I believe that making money is nice, but doing good is the best, right? So, because at the end of the day, I want a business that I feel is ethical and makes me feel like I actually served a purpose. So with people that are losing weight, oh my God, it makes you cry because suddenly their insides match their outsides. And suddenly somebody was able to cross their legs the other day. Suddenly they can begin to exercise and get healthier. That's what keeps us going. That's our purpose in life. How do I choose medicines? Well, I'm a biochemist, so I know a lot about them as it is. And then I look at and speak to our patients. We're doing the hair loss because when you lose a great bit of weight, your hair tends to thin. So that's why we paid attention to that. We're doing some derm products because people are getting more as the weight goes off, the fat leaves, they're seeing some wrinkles. So we're like responding to what our patients need. And then I do a lot of reading, Charles, a lot of reading. And I try to stay at the beginning of a bell curve of a business or a product. And then, if everybody else knows about it, it's too late. So I try to get a little bit early in.
Right. And then how does profitability jump into each of these? Like which one is the most profitable? Because weight management, let's say there's a lot of competition. Hair
Right.
loss, I feel it begins to have some traction. We're also seeing meds for focus and concentration take trend, and also upper. We've been talking, you and I, about testosterone. Well, men are focused a lot nowadays on keeping their testosterone levels high. So
Right.
how do you pick a niche regarding the competition that you have
Right.
and the demand of the market?
So, of course, safety and efficacy are the first two. So I want to make sure that, for example, we won't write phentermine online because it's so safety and efficacy with the patient. I speak to the physicians and decide what they feel comfortable with. Is this a good idea? I've heard of this idea. What do you think? So we'll bat it around in our medical board for a little while until we come to a decision. And then from that point on, we begin looking at the market and seeing what the market is. And if I feel that what I'm trying to do is get something before there's a market. So I'm looking to see if people that would be, I'm looking for traits. You know what I'm saying? Indications, thinning hair, for example, or something like that. People start asking. And then we just look for what we think are the best and safest products and put it out that way. As far as profitability goes, once you reverse engineer things, that for profitability, you decide what you need, and then you market back to what a fair price is. I'm trying really hard to hold our prices so that they're affordable. This medicine is expensive, and I'm trying to do what we can to take care of that.
Right. So what are your top goals this year's? With all of that being said, what are your focuses as a CEO?
Well, I made a mistake earlier in the quarter and picked the wrong EMR, medical record system, and it caused a serious drop in our business. So my goal was to get out of that particular problem and bring the business back, which we have. We turned our corners. Now we've got one more quarter. So we're trying to double our business by the end of this quarter just to recover from the mistake that we made by choosing the wrong thing. Next quarter, we're going to look into we may add medical marijuana. I'm batting that around. We'll do some things like that. So we intend to double our business. We did even though we had the hiccup, we did quite well this year, and we should do easily double that next year, easily.
Right. Yeah. Marijuana is an interesting niche, especially with the upcoming legalization. I believe that CBD is a really good solution as well. And there's going to be more and more science proving the efficacy of it. So that's quite exciting. And with your growth methods that you mentioned, Facebook ads, Insta ads, Google AdWords, what else do you have on the map when it comes to trying out new things? I don't know, like cold outreach, maybe. What else do you feel would bring you that 2x growth for next year?
You know, we've batted around cold outreach for quite some time. We are going to roll out something. I can't really tell you too much about it because it's in January, but we have a white glove service that we are rolling out. So it will be it is sort of cold opening. It won't be social media advertised. It's the exclusivity of it will make it is part of the marketing. And I think I'm very excited about that project. I wish I could tell you more. Give me a month and a half and we'll sit here and talk about it. I need to finish getting it launched before we go. I don't want anybody else to do it too.
Right.
So I'm
excited to see that happen. Where can people find out more about you until then?
They can get on BridgeSideTelehealth.com. We have a Facebook page, Insta, social. We do interviews with our physicians once a week. And I have a cookbook out, a nutritionist cookbook. So you can get on BridgeSide and get a copy of that if you want. It's free.
Thank you so much, Suzanne. That was Charles Cormier as your host, and Suzanne Braddock. That it was another CEO Wisdom podcast.